Hi everyone, we're going to get started. This presentation is called Pick, Pull, Scratch, Bite, and it is an introduction to body-focused repetitive behaviors. That's me, Susie Epling. I am an occupational therapist who is CBIT certified. I have my own telehealth practice where I treat people with tic disorders, as well as body-focused repetitive behaviors. And I'm very grateful for the Tourette Association of America for inviting me to um, speak. I also want to share that I am a Tourette mom. My daughter began ticking at the very young age of 10 months, and it was pretty bumpy along the way, but things are much, much better now. And I appreciate all the support that my family has had. That is Miles, my dog in the picture with me. He is a shish kapoo, in case you're wondering, and he's asleep now, so I hope that it stays that way. Okay, body-focused repetitive behaviors. What are they? Well, according to the DSM-5, they are considered to be an obsessive compulsive related disorder. Um, BFRB involves repetitive and often harmful self-grooming. This can include the pulling of hair, picking of skin, biting lips or cheeks, um, thumb sucking that is excessive and goes long beyond um, the expected age, nail biting, scratching of skin, scratching of the scalp. Um, BFRBs often lead to um, impairments such as scars, scabs, wounds, infections, um, bald spots. There can be a loss of eyebrows or every single eyelash. There can also be major dental issues caused by BFRBs, especially with thumb sucking. Okay, so tics and BFRBs have many similar components. Um, For one thing, you can be aware or unconscious that you're doing it. Um, Sometimes there's an urge, sometimes they're not. Um, they are non-functional. However, BFRBs are methodical. When someone has a BFRB, they're looking for something, some kind of a flaw on their body, and they're going after it. They're targeting certain parts of their body. Um, Tics are sudden, one by one, but can go on for a while. BFRB tends to be a very long, prolonged experience each time, sometimes for hours. Tics are repetitive movements or vocalizations. BFRB is strictly a repetitive self-grooming um, condition. So what else can I share? Just like with tics, they wax and wane. Onset is in youth. Um, they increase with fatigue or stress or just sedentary moments. People with tics will often say that they find them frustrating. People with BFRB will very often say that they experience immense shame. Okay. The other thing about tics is that they tend to occur kind of in random places. It might be more at school than at home. Um, BFRB is in very specific places, like just in the bedroom or just in the bathroom. So, as you've probably heard before, Tourette syndrome is also often considered as a iceberg condition where tics are at the very top. They're often what gets the most press, but there are very often co-occurring conditions um, below the water that are, in the long run, much more troubling. So according to 2007 National Survey of Children's Health, 79% of people with TS have at least one co-occurring condition. 64% ADHD, 43% behavioral or conduct problems, 40% anxiety, 36% depression, 28% developmental delay. What we're also seeing is a lot more people also have been diagnosed with autism, and with autism, of course, there are many other co-occurring conditions. Um, I believe that BFRB is also a co-occurring condition that deserves a little space on this iceberg, a little more attention. So, what is the prevalence of BFRB in youth with Tourette syndrome? According to one study of 739 youth with TS, 5.8% to 18.4% have skin picking disorder. 2.4% to 7.6% have hair picking disorder, and 6.8%, 6.0% to 11.8% have pathological nail biting. I can tell you from my own practice, I see a very high number of people with nail biting. Whether or not you consider that a BFRB or not, I think just depends on the severity and also whether or not it's causing damage. The damage that comes to mind most often with nail biting would be seeing kids who are repeatedly getting sick over and over and over, much more than their peers. And it seems that that's often from touching things and then putting their fingers in their mouth. Okay, so we're going to talk about skin picking disorder right now. And skin picking disorder is a condition that, like all other BFRBs, can start at any age. Often starts with maybe just like a scratch or a bump or dry skin. Some older kids may say that it starts with pimples. They're trying to pop the pimples. There's also a significant amount of skin picking on fingers. That tends to have a little different presentation than skin picking on the rest of the body. Okay, so now I'm going to share a video that was posted on YouTube of someone with skin picking disorder.
This was not here. Like all of these marks right now, they all came this year. Like all of that was not there at the end of 2021. But like I said, I came into 2022 like broken basically. So even when I was younger, like I used to be a finger like skin biter. Like any hangnail, I'm getting it with my teeth. So my fingers used to stay looking pink. Oh my gosh, it used to be painful actually. I grew out of it because I started getting my nails done and that shit would be burning, so I had to stop. Picking bumps and stuff like that, it's more satisfying. I know this sounds so gross right now, but it's like more satisfying and you kind of get gratification when you have stress. You get pimples, and like I was getting hormonal pimples on my chin and my jawline, and I was just popping those things, like, like I would get my tools and go ham. Like I don't travel without these things because I'm just like, ooh, there might be like something that sometimes pimples just want to pop up out of nowhere. And, me thinking that I'm like an expert, like at getting pimples out, I make it worse. And I'm always shocked. I'm always like, oh my gosh, I can't believe I have all these black marks because it's like, I kind of go into like I kind of get lost when I like start picking my skin. And when I say I picked everywhere, like that would like include like my hairline. And I already have like fine edges, so over time it just gets worse and worse, and like I have to like strategically place my edges, Like turkey, I'm on my way, but No, but no, like now, like just knowing that I just kind of have the tools to be able to look at it and be like, oh, look at you, you're about to start, you're about to start picking your skin. So sometimes, I mean, I still pick my skin, but like I try not to like actually break my skin, you know? And yeah, just being able to like keeping up with my like skin regimen and stuff like that, which helps with, the bumps. Like right now, I am in a good space for not picking my skin. This was not here,
Oops.
like all of these.
Okay. So I really appreciate the people who have posted videos about their experience, because I feel like, just like with Tourette's and tic disorders, you really need to meet people and talk to people who are experiencing it themselves to gain an understanding of what's going on. We're now going to talk about hair pulling disorder. In the past, it was referred to as trichotillomania or trick. It is now more PC to say hair pulling disorder. The pulling of the hair can occur on a beard, can occur on the scalp, eyelashes, eyebrows, and oftentimes, just like with the woman who had the utensils for skin picking, utensils can also be used for hair pulling, specifically tweezers. So now we're going to watch a video um, related to hair pulling disorder.
Cage is like a weapon, tool for me. You think I'm like the other one? Well, my cage is a weapon, it's perfect for me. So once through the seams cannot see. I'm a woman of my word. Now haven't you heard? My word's the only thing God ever needed. I'm a woman of my word. Now you have heard my word's the only thing God truly needs. Woman, 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 woman. Woman, 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 woman.
If you know people who know me, you might want them to speak, to tell you about the girl or the woman they know more than you think you know about me, more than you think you know me. See you walking in circles, see you talking in circles. See your thoughts running in circles. I walk around all day long, following me. The doctor said I was better than ever. Man, you should have seen me. The doctor said I was not my past. He said I was feeling free. Taking the jump, took the lead. I needed. I wanted my word.
like a weapon.
Okay, so from that video, it's very easy to see how much having a body focused repetitive behavior can get in the way of someone's social life. Just participating in a simple pool party, getting the courage to go, trying to cover up perceived flaws. You also saw in that video some rituals. So that young woman was keeping track of how many days she could go without pulling. So there were a number of zeros, so 0 hairs were pulled on those days. Then she had a ritual where she was actually keeping the hairs on her wall and then counting and marking them. So what I want to talk about now is the lack of awareness that sometimes comes with having a body-focused repetitive behavior. Oftentimes with younger children, you'll see lack of awareness as far as ticks, right? So a kid will be ticking away, ticking away, ticking away, and a parent can't believe that they're not noticing it. The same thing can go with BFRBs sometimes, in that someone might be doing it, and not being aware until much later. In fact, 5 minutes might go by in an hour. Or maybe I'm saying that wrong. It might feel like 5 minutes, but really it's an hour. So there's a constant need for having clocks around, having alarms around. Assistive technology also helps greatly as far as increasing awareness and cutting time down spent on the behavior. Okay, so the next video that I want to share is related to nail biting disorder.
It's not uncommon for a child to AIDS.
I've been biting my nails since I was 2 years old. I'm 54 now and I've never stopped. My stepmom always yelling at me, "Get your fingers out of your mouth, get your fingers out of your mouth." There was a time in high school, I used to bite my knuckles and they would just be all bitten up. In my 20s, I had a boyfriend that told me that my nails were really ugly. I started wearing fake nails every single day of my life. It consumes me. Usually I have 10 fake nails on. Pressed, glued, filed. I'm pretty good about not biting my nails at work, but once I'm in the car, I immediately chew all of them off. Chew my regular fingernails the most, and I don't stop until it's all gone. By the end of the day, I've bitten everything that can be bit off of my nail. It hurts so bad, and that's every day.
It's not uncommon for a child to bite their nails, but for 54-year-old.
Okay, so nail biting definitely can be a concern for some, not so much for others. With BFRB, most people say that while they are actually picking or pulling or scratching or biting or sucking their thumb, they have a real sense of relief. It's very soothing. This same feeling is related to what many people feel after they tick. So after they tick, they feel this sense of relief. So with the BFRB, it's while they're actually doing the behavior. And afterwards, the most common feeling is deep, deep shame that they've done it and they've done it again. The most common treatment for BFRB is habit reversal, just like with tic disorders and Tourette's. The gold standard is habit reversal treatment, specifically CBIT, CBIT, comprehensive behavioral intervention for tics. A treatment approach, just like with Tourette's and other tic disorders, is really critical. There need to be a lot of different people involved. In the case of BFRB, there needs to be more screening by PCPs. Oftentimes a dermatologist has to be involved, especially if there's infection. There needs to be a neurologist to say, no, that's not a tic, that's something else. Social workers, psychologists, psychiatrists, physical therapists are very necessary because oftentimes there's pain due to repetitive behaviors, and of course, occupational therapists. So unfortunately, I do have to say at this time, the largest BFRB organization does not permit occupational therapists or physical therapists to be listed as providers. I do hope that will change and things become more inclusive. As far as treatment methods for BFRB, certainly using competing responses as taught with CBIT are incredibly helpful. Teaching someone that they do have the power to pull their hand away, they can put it behind their back, and they can restrain it. CBT exposure and response prevention is used, DBT, and more often than not, the comprehensive model for behavioral treatments, also known as COMB. The way that COMB raises awareness of the behavior is through something that's called SCAMP. So SCAMP stands for sensations, cognition, affect, movement, and place. So when talking to someone about their BFRB and wanting to support them, you really have to think about what is happening before, during, and after the action. So common sensations before, looking at what they're seeing, what they're hearing, what they're doing. It's very often that they're not doing a whole lot. So they might be just looking at their phone or watching TV. Cognition might be thoughts about, well, they had a hard day, they deserve to just do it once or do it twice. Affect might be, affect would be the mood they're having. So they might be feeling really tired or fatigued or anxious or upset. The movement would be basic anatomy, like what muscles are involved, how are they moving, when are they moving, how fast are they moving, and then looking at the place. So it's really critical to understand where the biting or picking or pulling is occurring. Oftentimes it'll be in the back seat of a car, or it might be on the right side of the couch, or it might be in the bedroom propped against pillows. So changing the environment, having some environmental modification can go a really long way. Many people who have BFRB will say that they experience pain with the action, and that in some way the pain is welcome, and that's why they keep doing it. So for example, people who pull their eyelashes might find that there are certain eyelashes when they pull them that are more painful, and they will target those areas. So it's often very helpful to introduce different types of pain that aren't as disruptive. That could include like a DBT method of holding an ice cube, or it could include soaking a washcloth and putting it in the freezer and then ripping it apart later. It could also include just taking a bag of frozen peas and holding onto that. Okay, so now we're going to talk about blockers. So blockers are something that you can put between yourself. For the most part here, we're talking about your hand. So between your fingertips and the places that are targeted. So certainly the competing response of just holding your hand away for a minute or even longer, until the urge goes away, could be considered, I think, a blocker. But more often we're thinking about maybe putting a hat on to, prevent touching of the scalp, or putting Band-Aids over the fingers to decrease the sensation on the fingers, and putting a barrier there. Sometimes medical tape can be used the same way. Putting skin lotion on can also be like a blocker because it's changing the sensation of the skin. The more moist the skin is and the better condition, the less picking will occur. Blockers could also be wearing gloves. That's a lot easier in New England winters than other times of the year. Can also be putting on some type of artificial nail. By putting on an artificial nail, it makes it harder to get to the fingertips. You lose some of that sensation. And then another blocker would include just keeping hair wet. So when hair is wet, it is much harder to pull. So that's a very common strategy. Another strategy, just like with tics, Tourette's, busy hands, safe body, busy mind. So pretty much trying to be fidgety is a good thing. So there are just typical fidgets you can get the dollar store. Origami is a great fidget. That's what pretty much saved my child's life. You can use hand strengtheners. You can doodle, knit, any type of crafts. Just having a snack. Busy hands. Key. Okay, so there was a really interesting research paper put out by Dr. Erica Greenberg, as well as Dr. Jeremiah Scharf and colleagues. And what I got out of it, most important, was that more clinicians need to be screening for BFRB. I can tell you for a fact that my child is 20 and was never once screened for BFRB. And I think that's the case for many children. Screening allows for more education to be done, more advocacy, and screenings and solutions, to be put into place. Okay, so I'm going to end now with a mom's reflection on body-focused repetitive behaviors. This is the mom of one of my patients who I think has really been there for her children and wants to help advocate for others. So she writes, having a child with a BFRB is a difficult and frustrating journey where all my initial instincts were dead wrong, and I have probably ended up closer to my children than I ever would have. I have met them where they are, and I have learned to support them without trying to change them. Here is how it has been for me watching my wonderful 3 daughters who are all in their 20s. I've seen my eldest daughter without the beautiful long lashes she was born with for the past 8 years. I've seen my middle daughter with very short little hairs on her head and a very long hairs and everything in between, and needing to wear a hairpiece and hair extensions since she was 14. And I've seen my youngest daughter with big excoriated areas on her face that she dug out with tweezers this year. Her first real foray into demonstrating a BFRB, though of course it was in there. I had never even heard of trichotillomania or any BFRBs when this all started. My daughters are normal people. My husband and I are normal people. And I was ashamed. I would say to this day that other people in our lives probably don't really understand. The difference now is that I couldn't care less. That has freed me. My strategy is only to love my children and meet them where they are. If they are ready to talk about it, I'm ready too, and I will support them any way that I can. But I've learned that I can never push. It's not my journey. My best advice is to look in the eyes of your children, not what the damage is from from the BFRB. So with that, you've been introduced to 3 different women who have BFRB, as well as a parent. And so I hope that you now can stand in their shoes a bit and support your child or yourself if necessary. So that brings us to the end. Many thanks to the TREAD Association of America, fellow providers, patients and families. And there are resources that will be attached, and I'm available for any questions. Thank you very much.